on Saturdays?
Oh, he goes to Little Gym. Not with me, with Honey and Papa, because they do it on a Saturday when I can't go, so they get to bring him without me. Another control thing.
How we doing there, Doc? Can you have a look there?
That looks great.
We look great.
Yes.
Hi, family. Dr. Hooten here at Hooten Family Healing Center in Dallas, Texas, with the lovely Christine Rhodes, who has done just a fantastic job of managing the office these last 3 years.
Just about.
So she's the first lovely face out of 3 lovely faces we have in this office that you'll see. Just a quick reminder for anybody out there that's just started care, or maybe you've been under care for a while. What's the big story? Is it blurry?
There is nothing coming out.
And we're getting told we're having video difficulties, so we may have to start this over again. Just be patient. What's it doing?
There is nothing here in the page.
What's that one saying? Can you go look?
It says live.
It says
It's
live. So if you're out there watching, maybe ping us a message. Can you scroll? Let me see, Doc.
There is no video, is not showing.
Yeah, we're on there.
Found it?
Yes, we're going. Okay. If I'm waving, how far is it? What's the delay? Okay, look, I started this whole journey when I was a kid. And I know a lot of you have children in your life. Maybe this was you, or maybe it's still you, with breathing problems. You know, some of my earliest memories were taking medication for asthma, lung infections. I seem to be in the hospital a bunch as a toddler. That's what I'm told, that I was in the hospital like 12 times. You know, I've got a kid now. I've got an 8-year-old. I can't imagine, you know, her not breathing and having to rush off to the hospital. I mean, my parents were doing what they thought. I had an uncle that was a pharmacist. There were a lot of people that cared about me, but as you probably know, the only solution they have is here's your medication, here's your drug. Nowadays, the drugs for breathing problems are like Singulair, Advair. Can you think of any others?
Those are the main ones.
Some of the drugs I was taking as a kid aren't on the market anymore because the side effects piled up so much. And as I grew up, I stayed sick. I just remember not being able to finish soccer games sometimes, or baseball games. And it was tough. You know, my health was always sort of at the pinnacle of everything. And whether you're a kid or you have a kid, or maybe this is you and you've got some type of health issue you're dealing with, and maybe some of you are dealing with health issues and you're in denial, right? Where you know you could be doing better. Maybe you've got some niggling pains. Maybe you're taking a blood pressure medicine or headache medication. What happened to me at 13 years old, essentially I was carried in, or walked in barely, to a chiropractor who told us about the spine and how it affects our health. This wasn't just any chiropractor. This was what we call a functional chiropractor, or somebody that is trying to correct the spine so that the brain and body can work. And my spine was all fouled up, probably from birth, maybe from a trauma, learning how to walk. You know, how many of you are a baby learning how to walk? You probably traumatized your spine. Then you throw football in the equation, or sitting over a desk, or what's this thing everybody's doing nowadays, looking down at their phone. That traumatizes your spine. And if you don't take care of it, it's impossible for you to be 100% healthy. It's impossible. Because your brain and spine they house the power that controls everything. So when I started getting adjusted, my brain and spine started communicating better with my lungs, my immune system kicked in. I was off those medications before you know it. I haven't taken a drug for asthma or anything similar to that for 30 years now, and I'm not going back. I mean, I'm taking care of my spine all the time, daily, let alone getting adjusted. I have the great Dr. Angela here who adjusts me all the time. And I want to give you hope. If you're dealing with some type of issue that's not going away, like, in other words, if you're having to take medication, that means your body's not working and you need to start getting adjusted. If your nerves aren't getting to your body, you cannot be 100% healthy. I don't care what doctor you talk to. I mean, we had a guy, can't say his name here, but he had a wrist surgery, right? You know what I'm talking about? He had one wrist surgery for carpal tunnel. His arm had been numb and hurting and everything. And the surgery didn't fix anything. He's come out of it, he's still numb and hurting, and now he's having to deal with the complications from a surgery. Well, then his other arm started to go numb. And so he'd go into the doctors and all these neurologists and all these tests and everything, and nobody telling him why his body wasn't working. They kept trying to treat the symptom. And that's what I'm telling you that for. You can't treat a symptom, whether it's thyroid problems or headaches or weight loss or pain. You can't treat the symptom. You have to treat the person. You have to get the body working. And that's what I told this guy. And there was a big problem up in his neck that he had no idea. So I started adjusting him there. And wouldn't you know, his arm, the one he didn't have surgery on, woke up that day. Like, he got some immediate relief. And all he could think about was like, man, I wish I'd have done this before I had that surgery.
Yeah.
Well, Christine had, and now he's obviously taking care of her spine. Christine had, what do you do for Brody's health? So how old is Brody?
Brody just turned 1.
Just turned 1. He's awesome. We love him.
Yes.
Little heartbreaker.
Yes.
Little troublemaker.
Yes. All the love.
Yeah, what do you do for Brody's health at 1-year-old?
I get him adjusted weekly. That was our plan since day 1.
And I probably see him twice a week, actually.
Sometimes 3, at least.
Sometimes 3.
Mm-hmm.
Why do you get him adjusted? Why do you get a 1-year-old baby adjusted?
Why not? Get a 1-year-old adjusted.
That's a great question. This guy I mentioned, it looks like he has had damage in his spine since he was a toddler.
Yeah.
I know mine was damaged when I was a toddler.
Yeah.
So if there's something wrong with the spine, shouldn't you take care of it when they're
Yeah, why not start
little?
early? Yeah.
And you had a little bit of a scare. Tell everybody about that real quick.
They diagnosed Brody with hearing loss at only about a month old. Told us it was game over, permanent nerve damage, hearing aids, it was all happening. We continue to get him adjusted, and his hearing is 100%.
Yeah, so he goes in to the doctor. They take Brody to the doctor, obviously, and he does all these testing. So here's the doctor. The specialist, right? The ones that you are probably relying on to keep you healthy. They cannot do that. Do you understand? A doctor cannot keep you healthy. All they can do is medicate you or patch you up, right? If you have a bad crash. I've been there. I shattered my elbow. I didn't want to go, but I had to go.
Yeah.
In this case, here's this, they tell her Brody's got permanent hearing loss. We're over here saying, slow down, let this body develop, let this newborn baby, what is he, 1 month old when they told you all that, or 2 months old?
Yeah, probably 1.
There's no emergency. So he's getting adjusted, and his body kicked in, and how's he hearing?
100%.
100% hearing. Right? So what are you going to do for his health moving forward?
We're going to get him adjusted forever. I want him to be, this is part of his life, this is part of his routine, keeping his spine healthy. And
yeah, what would you tell a parent out there with a baby?
Why would you not want your baby at all, the best they can be? Why not start early? Why not come in here when you're 30 with your back hurting or migraines? Why not kick in the butt, take care of yourself when your baby's a baby?
Yeah, prevention.
Prevention, yeah.
Can you imagine if there's a problem with the baby's spine that the doctors don't look at? They just don't look at it. It's not.
No, they don't. No, they don't look at it.
I'm not blaming them. It's just not their area. That's our area. Can you imagine if a baby has a problem in their spine and they leave it there?
No.
It's going to get you at some point. So the point of the whole video is start taking care of your spine. It is so good for you. And now, there's different types of chiropractors, aren't there?
Oh, yeah. There's the type that don't even take an x-ray.
Yeah, we had a young lady in here yesterday. It's her first visit.
Yeah.
This excruciating back pain. Her legs were numb and all that. It ended her
Dancing career.
dancing, dreams of dancing, while she was in college and everything. And the neurologist and everybody she talked to, nobody looked at her neck. So we adjusted her neck way up here, and she got off the table with a little bit of relief in her back that had been bothering her for God knows how long. And it wasn't just her back. Listen, if your spine isn't working right, it'll mess up your metabolism. It'll mess up your digestive system. It will keep your body from fighting off cancer at 100%. Think about it. If your brain can't get to your body to communicate with it, and your body isn't getting all the information back up to your brain, how could you possibly fight off cancer at 100%? One of our, everybody's a miracle. I mean, you're a miracle. You're still a miracle no matter what's going on with you. But one of the more remarkable things I've seen over the years was this guy that had prostate cancer 25 years ago. So he goes through some treatment. It never really goes away. So he starts with our type of care 25 years ago at another office, getting adjusted regularly. Well, he comes in here and he'd been diligent for a long time, getting adjusted, eating properly, really healthy relationships. And he told us the other day his prostate numbers are normal. They've gone down, finally, with due diligence.
Mm-hmm.
So he's not worried about, cancer. He takes care of his spine, eats right, great relationships.
He's consistent. That's a big thing.
Yeah, so what would you tell a 30-year-old that's dealing with headaches or thyroid problems or something?
Don't wait another second to get in here. It's just going to get worse and worse. Do not wait. Imagine if you came in here 15 years ago.
Yeah, I mean, if you talk to people and you ask them how long do you want to live or do you want to make it up to 70, most people don't even want to think about that.
Yeah, it's true.
Why?
Because it sucks nowadays with all the medications everybody's on. They're like,
and we were talking earlier.
it's sad. It's really sad.
What do you want to do when you're 80?
I want to be at my grandkids' football games, graduations. I want to be there. I want to be their great grandparent. I want to be the grandparent. I want to be there for my family.
Me too, man.
Yeah.
So whatever you're going through right now, if you're struggling with a health issue, if you know somebody is, encourage them to get in here. There's a handful of our offices around the country here in the Metroplex. We can help you find somebody where we've got to get your spine flowing and connected to your body. If you do that first and then throw in proper food,
Mm-hmm.
get a little movement. We sit too much in this country. Try not to toxify your body. Your body kicks in. The miracles start happening. And I don't care what you've been through. I've seen people heal from stuff.
Yeah.
We don't treat the symptom at all. We literally focus on the body and they fix themselves. We had a guy recover his eyesight from all that glaucoma. Just off the top of your head?
The digestive issues that is my favorite right now.
All the time.
Yeah.
Constipation, diarrhea, irritable bowel syndrome, Crohn's.
Which
Yes.
is amazing. Mm-hmm.
It's supposed to
life-changing.
ulcerative colitis. And we're a
Yeah.
little 5-year-old girl that was bleeding. Remember that?
Mm-hmm.
Now she was 5. She got her first adjustment and her body quit bleeding that day. So if you've been dealing with something chronic for a long time, it may take you a while, but your body's still trying to heal, just like that 5-year-old girl. So we just want to encourage you, start taking care of yourself today. Don't wait another second. It's only going to get worse. If you're already hurting, my gosh, your body's screaming at you, get in here. We'll take real good care of you. We have all kinds of specials that we're running every month. We do something. Like right now we're doing a book drive.
Doing book drive right now. We're doing a fun day on Saturday.
Big party Saturday.
Big party Saturday, just for fun, just to celebrate you guys taking care of your health and just being here.
Big bounce house. Stay tuned for some more videos. Next video we're going to get into some food. I'm going to try and trick Christine a little bit, see if I can trick her, and give you guys little quizzes and that kind of thing. Really ramp up our game here. We love you guys. Remember, keep your adjusting schedule, make it a priority, and then everything else can start to work. Drugs are bad, God is great, and so are you. Thanks for watching.